Hi, my name is Craig Harling, and I am Vice President of Clinical Services with Horizon Health. And I want to share a little bit about what my role is. I work for the clinical team, and there are several of us that are on the clinical team. And really, there's 4 different things that we make as our primary goal when we're working with hospitals. The first and probably most important is that we want to provide practical support for the leadership of the hospital, for the leadership of the unit, and certainly for the staff that work on behavioral health units. I know there are a lot of organizations that are out there that when they provide consulting or they work with a hospital, they're great at pointing out what's not working, but they're not so good at follow through on what's going to work for this hospital in this particular situation. And that's the kind of practical support that we provide. In addition to practical support, we also make sure that hospitals are regulatory compliant. And so that ranges anywhere from federal guidelines, CMS, to state guidelines. There's a lot of regulations depending on the state, and also for other regulatory bodies like Joint Commission, DNV, that hospitals work with. So our goal is to make hospitals be regulatory compliant, to pass a survey with flying colors. Nothing excites me more than when I have an administrator at a hospital tell me that this was the first time they passed a survey without being cited for anything. So that's an exciting part of our role. And then a third part of our role is to reduce risk. And that really is critical too. We want you to be able to sleep at night. And so the way how we do that is we work with the hospital, we work with the program to reduce risks like suicide risk, violence risk, elopement risk, fall risk, depending on what the issues are on the unit. So we really want to do things and be proactive as far as preventing the types of bad outcomes that occur sometimes in hospital settings. And we do that by helping hospitals figure out ways to reduce those risks and to mitigate any kind of risks that they have, as well, of course, as identifying the risks that are there. And then the fourth and final thing that we do is that we really work with hospitals on training. We want the hospital to be prepared. We want the staff to be prepared too. And the way that we do that is through training. We have a lot of different kinds of materials that we can use to work with staff to be able to help them feel more confident in the role that they have. So we want the staff to be able to feel comfortable working with this population. It can be a very difficult population. It can be very risk averse. And so we want the staff to feel capable of working with those patients.